Hello and welcome. My name's Tyler Blah. I'm a final year medical student here in Sydney, Australia, and I'm also a bone marrow transplant vlogger as well. For today's video, I'm going to talk about leukemia symptoms, and that's both the ones that I personally experienced when I was diagnosed, and also talk about, well, the leukemia symptoms the doctors are taught to look out for, and the ones that they look for on examination, to combine both of my experiences. That is, one as the patient, and two as the doctor, or at least the medical student on the way. If you're new here, please feel free to just, hit that subscribe button. Otherwise, if you're a returning viewer, it's always so good to see you, and I'm glad to have you here today. So as I've mentioned in previous videos, I think it was actually some of the first videos I made, leukemia is a disease that affects the white blood cells, and those are the cells that are most importantly used for things such as our infections, and overall immune state, and some regulatory functions in the body. And so the disease itself, leukemia, presents with a dysfunction in these normal states. For me personally, I actually experienced very few symptoms, and it was the blood panel that we then ordered during the very minor symptoms that I was having that then revealed the need to actually, take that further investigation. And I'll talk about the investigations they can kind of do around that as well. So my personal experience with my own leukemia symptoms, essentially, I had managed to develop a flu that was, quite bad, and it lasted for over a week, and it was during that 1 week that I also managed to lose about 3 kilos. And that weight loss was, really unexpected. And I think definitely, as I look back on it, the most interesting part about that was at that time I was on a very controlled diet and exercise regime. So my weight was very closely scrutinized around that. And so when there was a 3 kilo loss, it was very obvious that it clearly couldn't have been due to diet or exercise, which are normally the things that could potentially contribute to a loss of weight. And so interestingly, it was a combination of the flu and my loss of weight that led the doctors to think that they should probably consider a blood test. Now, interestingly, I was being seen by a rheumatologist at the time, and it was actually my rheumatologist who decided that the blood test would be necessary. And I think that's a really kind of interesting thing to reflect on, because rheumatologists are genius when it comes to putting together all of these things that are kind of non-specific, and they can bring it all together to go, it's probably this. And so I really feel thankful that it was my rheumatologist that actually was reviewing me at that point in time, and they were the ones that decided a blood panel would be necessary. From that blood test, we saw that my platelets were quite abnormally low, and so the abnormally low platelets, particularly considering, my age and my overall medical background beforehand, this then led to a consultation with a hematologist, and in that consultation they decided that a bone marrow biopsy would be the best next step to then determining, is there a potential that this is leukemia? And within that, if they did determine it was leukemia, they could then potentially differentiate the subtypes. And it was from there that I then got my diagnosis of acute myeloid leukemia, with further molecular testing to then reveal it was inversion 16 clonal binding factor, also referred to as CBF. So that's my specific subtype that I was diagnosed with, AML inversion 16 CBF. All from that simple event of weight loss of 3 kilos and a flu. And that was really it, that then led to, the doctors taking the next step. And I'm very thankful for them having the ability and the forward thinking to take those next steps, because I'm here today because of it. So that's my story, at least. Let's talk about some of the other common symptoms that you can typically get in something like leukemia. Before I begin, I want you to tell me in the comments down below what your experience of symptoms was before your diagnosis, or someone that you knew before they were diagnosed, what were their symptoms that they experienced as well, just so that we kind of have all of this information being provided around symptom experience before diagnosis. I know personally I always found it interesting when I would speak to my friends on the hematology ward to kind of find out about how they got there, and I think it's really helped inform my own clinical decision making, so it'd be great if you could please share your own experience down below. Otherwise, let's jump right into the symptoms. So the first one is anemia. Now, anemia itself is defined as a low hemoglobin, which is essentially the molecule that is within the red blood cells, and it helps transport oxygen around the body and carbon dioxide as well. It's really important in that kind of tissue metabolism process. And so when you're low in hemoglobin, that's when you get anemia. What does that actually look like in a patient? What you can typically experience with anemia is weakness, a shortness of breath, dyspnea, bruising, and also pallor. And pallor just means you're a bit pale. And pallor can actually refer to either conjunctival pallor, which essentially just means if you do this on your eyelid, Yep, it's a great look, I know, but it's not quite as red. It actually becomes quite white, and that's one of the early signs of anemia. Otherwise, they may also just be a bit pale all over in their skin. The next common symptom is fever. Now, the fever itself directly is related to an infection typically, but it's from the leukemia that your white blood cells, well, they can't appropriately respond to an infection as they normally would. So you go into this state of, well, dominant fever because your body's struggling with that infection, and that can be an early symptom for your leukemia. Another symptom can be headache, particularly something that we call focal headache. Now, all the focal headache means is that it's essentially a headache where you can go, it hurts here, rather than it hurts all over. This can typically be due to, well, a bleed in your brain essentially, and that can also be on the background of the anemia as well. They kind of can interplay together, but that can be one of the symptoms that you can experience with leukemia. Now, I think it's really important that I reiterate right now that just because you experience these symptoms, it does not mean you have leukemia. These are such varying non-specific symptoms, and they do not diagnose AML at all. For instance, anemia can be due to many things. Headache, due to many things. Infection, well, it can be due to just an infection. My own experience, that loss of weight, which can also sometimes come with a loss of appetite, or even something that we call night fevers, although that's kind of crossing into lymphoma symptoms. These symptoms can also occur with other disease states. So you can't say, I've got this symptom, therefore I have leukemia, and I want to make sure that you know that. It's just that sometimes when they all come together, it can raise suspicion for a doctor to think, I should probably do a quick investigation just to rule this out because I don't want to miss it. And that's the most important part, is just the ruling out. And as I said, these do not diagnose you with AML at all. In fact, the diagnosis for AML specifically is based on the infiltration of your bone marrow or peripheral blood by approximately greater than 20% blast cells. And these blast cells would have the morphogenic, cytogenic, or immunochemical, phenotypic, classic presentation that you would see in AML. Now, what that means is essentially you've got these immature cells that are very clearly cancer cells upon further investigation. And that's how you can accurately diagnose AML. It's not based on the symptoms that I mentioned before. These are just some of the things that you may experience earlier in the stages of leukemia. But as you can see, the diagnosis of AML is very, very complicated, and that's why I'm not going to try to make a video around it, but rather just have a bit of a chat around what are some of the symptoms you can experience with leukemia, and about the symptoms I specifically encountered, because I didn't experience many of those symptoms I just listed. And importantly, the diagnosis in your country may be quite different as well, so don't trust just on this video what the diagnosis may require, because it may very well differ exactly where you are. I hope that this video has been useful, and you've learned a thing or two about leukemia. If you've made it this far into the video, I want you to prove to me that you're still here, and comment down below what's the favorite TV show that you're watching right now. My favorite show right now would have to be House MD that I'm rewatching for I think the 8th or the 9th time. It's honestly an addiction, but every time I watch it I'm just like, God, this is such a great show. But yeah, please tell me down below. Otherwise, thank you so much for watching. It's been great to have you here. I'm really glad I could kind of talk about, well, the leukemia symptoms, both ones I experienced and ones that others can commonly experience. And please don't forget to leave your comments down below. Otherwise, as always, remember, like, share, subscribe, and I'll see you all in the next video. Thanks, guys. Bye.